The rate of daily coronavirus vaccinations is slowing in the U.S., and healthcare providers fear a surplus will result in wasted doses. As of Wednesday, more than 142 million Americans had received their first dose of the COVID vaccine, and 98 million are now fully vaccinated. Meg Oliver has more from Philadelphia.
Tonight in Philadelphia, a surplus scare.
The city has a lot of vaccines in cold storage that do have to get used in a very short timeline.
With more than 1,000 doses expiring tomorrow, the city is now scrambling, shipping them to other distribution sites so they won't be forced to throw anything out. Around the country, shots are sitting unused.
I just don't think they've done enough research on it.
And for the first time in more than a month, the U.S. is averaging less than 2.5 million vaccinations a day. Vaccinations are down nearly 25% after peaking on April 11th. Meanwhile, in Oregon, a new COVID surge triggering restrictions that includes a ban on indoor dining. But in Tennessee, the governor tweeting, COVID-19 is no longer a health emergency in our state because of a widely available vaccine, but less than 25% of the state's population is fully vaccinated. In Lubbock, Texas,
I am here at our large-scale vaccination clinic, and as you can see, we have lots of empty chairs.
Vaccine hesitancy remains high and turnout low.
This is going to be an uphill battle. I really kind of see us in this time crunch of trying to get people vaccinated before we see some of these other variants.
For those still hesitant to roll up their sleeves, an appeal to the heart.
Not since World War II have all people been called to come together to protect humanity's future.
A nationwide coalition of healthcare providers running this ad with a single message.
This is our shot to save lives.
Today, the CDC unveiled new findings showing the Moderna and Pfizer vaccines are 94% effective in preventing hospitalizations among fully vaccinated adults 65 and older. Here in Philadelphia, they're hoping to vaccinate more people by keeping sites like this one behind me open later to attract walk-ins. No appointment needed. Elaine?
Meg Oliver, thank you. For more, let's bring in infectious disease physician Dr. Hlatshwayo Davis. Doctor, welcome. Thanks very much for joining us. As we heard, the U.S. now has a vaccine surplus. This comes as President Biden is reaching his 100th day in office. What do you make of his vaccine effort, and where do you see a need still for improvement?
I can't do anything but be very complimentary of what this administration has achieved. In December, we could barely get vaccines around the country. I sit on the Board of Health at the city of St. Louis, and it was really difficult in December, January, and even into February because we were getting a lot of pressure to vaccinate folks and just did not have enough vaccine. So what we've seen in this first 100 days has been an absolute triumph in getting vaccines to states and then to local health departments where they can be disseminated. But as the package just showed, we are seeing a lot around a lack of vaccine confidence. And this has shifted. At the end of last year, we saw this predominantly in Black and brown communities who have valid mistrust for scientific and medical institutions that have failed them both historically and presently. But these numbers have now shifted. A Kaiser Permanente survey a few weeks ago showed that these numbers are highest in people that identify as GOP and college uneducated men, close to 40%. And so this is all about trusted messengers, trusted resources, and where people are going to get their information and what they believe to be true around COVID.
Well, Dr. Anthony Fauci hopes the current COVID vaccines will receive full FDA approval very soon. Doctor, what impact could this have?
Well, I think the impact is that it will help with the long-term focus on how we're going to do this. I think for many people, the belief is that we are just existing within a few more months, and once everyone's vaccinated, we're out of the woods. But there's much more to that. We're still doing clinical trials in specialized populations. Pregnant women have clinical trials ongoing with preliminary data, extremely exciting and showing a lot of good safety there. And then young children who would like to see also vaccinated. And so all these trials are ongoing. So this will help to make sure that ongoing we can address COVID and make sure that it doesn't plague us for years to come.
Well, the FDA says the COVID vaccines are safe for pregnant women and have no effect on fertility. Remind us, doctor, what does the science show about these vaccines and reproductive health?
So what we saw was that last year we enrolled phase 1, 2, 3 clinical trials, and these did not include pregnant women. But we saw initially a good signal in that there were a group of women, too small of a number for us to say anything definitive, who subsequently became pregnant or gave birth. And women who have received the vaccine and have subsequently given birth, we have seen evidence of antibodies passed on to babies, which is fantastic because it shows that we can protect even the young if they're able to get these antibodies either from the vaccine from mom or potentially through breastfeeding. However, you cannot say anything definitive until you have done phase 3 clinical trials in the same population. And so that is currently what is underway in women. The preliminary data that has been given is from women who have given reports back about how they fared with the vaccine. And this is in such a large number of women that we are able to see that this safety data is highly promising. However, we are awaiting the end of these phase 3 clinical trials so that we can say the same as we did in Pfizer and Moderna around both safety and efficacy.
Another topic, doctor, the FDA has published new data on the accuracy of COVID antibody tests and the prevalence of false positives. Are antibody tests important, and can doctors and patients trust them?
Antibody tests are very important, but we can't assume that we can use them the same way that we use diagnostic tests, the tests that we use to test for coronavirus. They're completely different, and they're used in different ways. Antibody tests have a very important role in public health, because while they would not be the go-to test for diagnosing COVID, used in the right way, and that right way is with the work of epidemiologists who understand the numbers, know how to make adjustments and how to use the data given to say something more about the broad public, right? It's very different to use a test that must tell you something with a high degree of accuracy for one person than a test that will help you to say something meaningful about the public. When you're doing that at such a mass scale, I think antibody tests have a crucial and very important role. And once we know the number of times that we can expect false positive rates, for example, adjustments can be made so that we can say meaningful things for society. So antibody tests, again, I believe, have a crucial role in us better understanding this pandemic and being able to address it.
Finally, let's look at the global situation. Dr. Fauci says that rich countries need to take more responsibility in aiding areas of the world where infection rates are high. Which parts of the globe are of most concern right now?
Thank you for such an important question, because I believe that we need to be talking about this more and making platforms available. Right now, we all know that what is happening in India is absolutely catastrophic, a COVID crisis where people are dying at really alarming rates every day, and they do not have enough resources to be able to take care of everyone who needs their care. But I say this, and I want to be very clear. I come from a low-income country in Zimbabwe. There are countries around the world, like the country I was born in, that will never make the news, but for whom this type of urgency has existed since the beginning and continues to. We cannot operate as if we are on an island. Any threat around the world is a threat to us all. We are a global community. And so if we ignore and do not contribute to countries like India and other low-income countries like Zimbabwe, where I was born, this will continue to plague us for years to come. I am so proud of the Biden-Harris administration for addressing this head on. They had previously made the largest single donation to COVAX, which is the collaborative that has been convened to help to make donations of vaccines to low and middle income countries across the world, but also stepped up and made a variety of donations to India this week with the promise of previously stored AstraZeneca once they've gone through FDA quality assurances, and other PPE, oxygenation machines, and raw materials to help India be able to produce for themselves in the long term. This is the type of leadership that we need to see now and ongoing around the world.
Dr. Hlatshwayo Davis. Doctor, thank you very much for joining us.
Thank you so much for having me.